Are you suffering by the white patch skin on your body, or your known person, friend, colleague or relative, or the person you might know very well suffering from this white patch skin? Then this video is for them. Please do share it and spread the awareness. I want the people to know about these things. This is called as vitiligo camouflage white patches. Okay, in this session, in this video, I'm mainly going to talk about what is vitiligo, what are all the symptoms, and why does that happening, and types of vitiligos, and what are the treatments are available, and how we are so special in our Machu clinic and what we are doing in our Machu clinic. So in this session, I'm going to explain you everything completely. Do watch this video completely to understand about each and everything, because every topics will be correlated in between. So when I'm talking about the types of vitiligo, when I'm talking about the treatment, I'll correlate in between those topics. So every topics are correlately connected. So do watch this video completely. You will get a much more better idea. Then you can proceed and go ahead with the treatment. And please do share it, as I said you earlier, to everyone who you know who are all affected with this white patches. And let's get into the topic now. The first most important thing is, what is vitiligo? Vitiligo is one of the autoimmune system disorder problems. Some of them talking about, sometimes scientists and the researchers telling about the different things. It mainly happens sudden white patches in our body. Maybe it happens in our hair. Hair will become a gray and then the white in color. Body places here and there, the white patches used to come. So this is how this vitiligo starts to spreading, and it will not stop and it keeps start to spreading. Okay, why does this happen? Mainly because melanocytes will stop to deliver the melanin. Melanin is the reason for our skin tone as well as our hair colors. So when melanocyte cells stop to producing this melanin, then this vitiligo will start to happen. There are multiple types of reasons why melanocyte cells stop producing the melanin. How does vitiligo progress? Yes, so vitiligo will start to spread in a very small patch. So if we did not take out and if we did not see and take a proper treatment for that, then it will start to spread all over the body, maybe over the month of courses of the period, like maybe a years or maybe a months or maybe a weeks. It depends on how ferocious that vitiligo immune system spreading is happening. So starting itself, when the white patch starts to happen, we need to be treated well, then we can be able to stop spreading a lot. So it will be start to spread with the small patches, and most of the moist lining places, we'll call as a molecules places, those places it will start to spread a lot, especially ear lines, and then the nose lines, and then the rectal areas, private rectal areas, all those places, mouth lines. So these are all the moist lines people used to say, those lines it will start to spread a lot. And some of the times the wide spreading areas, it will be start to spread a lot, or sometimes throughout the process some people will start to regain the pigments. Due to regaining the pigments, big patches will start to get reduced to small, or the small places patches used to happen, it will start to become stable, it will not going to spread anymore. So these things also will be happen. Many of the scientists still doing the research how this is going to be get stable, how it's going to get regaining it. So it's in the confusion stage how this progress is taken over. But this progress keeps changes person to person, depends on their immune system and then the body how it's reacting to that vitiligo white patch. Types of vitiligos. Yes, there is a lot of types of vitiligos. Many of them doesn't know about it. Everybody thinks there is a vitiligos all kind of same and looks the spreading wise everything it's kind of same, but it is not. There is a different types of vitiligos are there. I will tell you, and you can be get to know what type of vitiligos you got affected, or your friends, relatives, or anybody who knows you watching a video got affected it. Okay, so number one, generalized. So generalized is the most common vitiligo patch. That means vitiligo patch will start to happen in some particular places of the body. There is no like a particular like a one side, nothing like that. It happens on anywhere of the body, but it will stop to spreading and it will be keep stable. In future, maybe 1 or 2 years, if the spreading starts to happen again it will start to spread. Until then, it will be stay stable. So that is called a generalized vitiligo pattern. And then the second thing is segmental vitiligo. Segmental vitiligo is nothing but it happens on one side of the body. Yes, sometimes you might have seen the people, one side of the body, right side will be completely perfect and normal. Left side of the body, they will be start to lose the pigments, especially on the hands or the legs. Left side only it happens. That's called as segmental vitiligo. And third important thing is musical vitiligo. As I said you earlier in the previous session, this musical vitiligo happens on the mucous membranes of mouth or genital areas. So those places only vitiligo happens. It does not happen or spread it or anywhere, hand, leg, or none of the places. It happens only on this mucous membranes areas. So this is called the musical vitiligo. And fourth thing is focal vitiligo. Focal vitiligo is one of the quite kind of rare vitiligos. It happens only on a particular point. A small points, like a small place it used to happen, and it will not going to spread anymore. And after that, small dots will happen. It will not comes like a huge big patches. It will comes like small dots, and it will not going to spread. After 2-3 years, if it's anything again, it's got stimulated again, there is a chance of spreading. But even though that spreading also will not happen huge, just a dots will happen. That's called a focal vitiligo. The number 5th type, trichome. Trichome is one of the vitiligo types, and how this trichome vitiligo works, because there is a 3 tones will be there. Usually the center place will be white or colorless area, and surrounding place will be the little blended color. It's not an exact skin color, it's not a complete white color, it will be the blended color of both the things, and then normal skin. So 3 types of tones will be there. This is called a trichome vitiligo. It's also one of a rare vitiligo patch. It happens, center will be so violent and then the more focused, and then it will be start to get little normal and then dies. So it will be kind of ombre effect it will be. So this is one of the trichome vitiligo patch. And then the 6th last type of vitiligo is called as universal vitiligo. This universal vitiligo is one of the very rare one, and it is the really a bad thing to be happen. That is, overall body will start to lack the skin pigment. Yes, overall body will start to become a complete white in color. Overall the pigment will completely goes off. Hairs also will start to looks golden and white in color. So it happens quite rarely. It's not a quite common one. So these are all the 6 types of vitiligo. How common is vitiligo? Yes, many of them used to get scared how common it is, how commonly it's spreading among the people. Will this start to spreading person to person? So it is not going to spread the person to person. Many of them thinks going near to the person who affected a vitiligo also spread as the vitiligo. No, it does not happen in that way. It does not happen at all. So majorly now, as per the survey, people are telling overall population 1% of the people have a vitiligo. They have affected by the vitiligo white patches. So nowadays it's the percentage is getting increased because people are lack of exposing into the direct sun. Correct? That's one of the important thing. People lack of exposing into the direct sun, and nowadays many of the kids also started getting affecting because people are not allowing their kids to go play outside into the direct sun exposure. That's one of the important thing we need to remember. So the kids between the age of 5 to 10 as well as the age between 10 to 30 people are most commonly affecting by this vitiligo patches. So be aware about it, and this is how the common of vitiligo it is here as of now as per the survey. So keep that in mind. What causes vitiligo? So although there is no particular point of talking about this is the exact scenarios or these are all the scenarios, there is nothing like that, but there is the different theories. This might be the reasons for this vitiligo. So number 1 thing is autoimmune disorder. So our immune system will start to create the antibodies that will go and defeat the melanocytes. So due to its going and fighting with the melanocytes will stop to produce the melanins, and it will stop to deliver the melanins. That's why people started losing the color. This is one of the theory has been proposed by one of the scientists in 1971. So this is, as of now, it's people are believing that this is also one of the reasons that people are getting a vitiligo. And then the second reason might be is defected self-destruction. That means a defected melanocytes cell. So if the already cells got defected by any of the stress, physical, stress or emotion, whatever it might be, if that cell got already destructed, then there is the chance of it destructs themselves. So the melanocyte cells destruct themselves to produce the melanin, so it will not produce melanin at all. This is one of the reason to stop producing melanins. And another thing proposed by one of our scientists is genetic factors. Yes, 30% of the vitiligo who already have their families who has a vitiligo, they are getting a vitiligo on their body. This is mainly happens because of genetic transformation, same like diabetics 1, diabetics 2. So when it comes to that, again, it stopped producing the melanins by the melanocyte cells, so it's causing a vitiligo. That's the end results of it. Then number 4, neurogenic factors. Yes, neurogenic factors also placing a key important role. As per the survey happens in 1982, a substance which is released from the nerve endings, that substance is toxic to the melanocyte cells. Okay, so due to that nerve endings producing the substance, and it's beating and fighting with the melanocytes, and it stopped producing the melanin layer for the skin. That's why our skin will start to get the white patches. It is also one of the reasons. These 4 reasons as a theories people has proposed it, but as of now there is no accountability of this is the particular reason for doing this particular skin disease happening. So people are still in the confusion why this is happening. That's why treatment is also not much proper. So in the next session, I'm going to talk about what are all the treatments available for this session and how we are treating and why we are special in it. What are all the ways to treat the vitiligo? Yes. So in this session, I'm going to tell you about there is a different types of sessions most commonly people used to take. I'm going to talk about those things first, then I'm going to talk about what treatment which we are providing, why it's so special comparing to the other treatments, and what will be the difference. Everything I'll be explaining you in a coming session. Okay, so the first we are going to talk about most common thing. Even in a Google, when you type about vitiligo treatment, this is what you are going to get in the first, and this is one of the most common treatment, that is light therapy. Yes, and light therapy is nothing but taking a narrow band of UVB rays and pointing it on your melanocytes, the patch where you got affected, white patch. They'll be thrown that beam on top of it, and with the help of oral slonomenin as well as this UVB, people used to take this. So this they'll be take it like a three times a week, or some people will be getting a day per day itself 2-3 times, and this will be goes for several months. Yes, and there is no research scientifically proven that this is going to develop the skin pigment on the affected areas. There is no particular research proven that, and there is no accountability of how long you need to continue this treatment and how effective it will be. There is no accountability for that. And especially if you are a person getting it in fingers or a mouth or any of the mucal areas, genitals or any other places, then this treatment will not work in those places. This treatment may work in a normal places, but in that also there is no accountability of how long it's going to take and how faster it's going to be get healed. In our clinic, many of the times whenever the clients comes down, we see the people getting this treatment done and came to us to get our treatment to be done. So that times we used to see the skin due to this UVB their color tone itself will be starts to completely change. They used to be looks quite fair, but now they look so darker. So this UVB ends to create a darker and the patchy look on their skin. That will be really bad to the as a output, and people used to suffer a lot. So some of the times people used to ask us to be undo that, but that is not at all possible, because you are straight away putting a UV rays on your skin instead of contracting to that. So it's one of the bad decision to treat your vitiligo, and I will never recommend this vitiligo treatment to be anybody. And this is what most of the time people commonly starts to treat their vitiligo. Then number second treatment most commonly people used to take is repigmentation therapy. Yes, repigmentation therapy, usually how it works is people take corticosteroid tablets or corticosteroid cream, topical cream on top of the skin. They used to apply on that affected place, or they'll be take it orally also. Both the things they used to do, and they'll be start to take this for again several months. There is no accountability of how long they need to take and how long it's going to be output to be get created. So they keeps taking it. The problem here is it has a lot of side effects in it. That's a really sad part about this repigmentation therapy. Due to this, some of the times people start to get clusters, muscle clusters on their body, fat clusters, they used to say. Some people, they start to get those muscle clusters on their body. That will be really hard to be get treated, as well as hair fall used to happen a lot. Especially in a male, this corticosteroid repigmentation therapy causes impotence. So they'll be have erection problems, and they'll be have a loss of interest on the sex. So those things used to be happen for some people. So this has a lot of side effects, and even though if you try to manage all those side effects and getting this treatment, are you going to get the effect? If you might have seen it, if you have asked it, there is a question. It's not fixed that you are going to get the exact output. There is a lot of chances you may not get the output. So this is also, there is no proper scientific research shown or proof that you are going to get the exact output. That's the truth about this. Then number third common treatment people used to follow for vitiligo is surgeries. Under the name of surgery, we can call this as a skin grafting. Yes, skin grafting, many of them used to take. This is nothing but taking an autologous, where the normal skin pigment will be there on the particular person's body. They'll be take the melanin pigments from there and keeping it by the skin grafting method to the affected areas. So it has a lot of complication of scarring, as well as leaves the infections, or this repigmentation may cause the infections and it will become a very thickened layer. It may cause keloid scars also. Many of the times when the clients comes to us to get the treatment, they used to get this earlier, this skin grafting treatment. I have seen a lot of people, skin got scarred a lot, and it's a huge damage for their skin. Lot of scars will be there, and it's damaged a lot, and they used to get suffered a lot. There's a lot of dots on their skin. It looks really bad. Maybe a vitiligo might looks little good comparing to the skin grafting effects. So I'll never recommend this. Because of this treatment, there is a lot of chances you may be going through a more depression because of that output. As well as there is another technique, surgery, plastic surgery. They'll be take a scar of normal skin and keeping it, but there is no point of doing it. The place where you have taken the normal skin, there you'll be get a huge scar. And by making a scar, you are going to cover that another place, and this requires very, very costly. And if you did not go ahead with the proper doctor, this also will be get ruined, and it is not a effective one, I would say. And the fourth final treatment is from our Machu clinic. We are providing a MPT treatment. This MPT treatment is one of the latest technique, and you may ask me, will this treatment is going to give you my 100% of the result? No, but I can make sure. As of now, in the previous treatments I was telling you, there is no accountability of how much it's coming out, but here I can give you the accountability of 80% of chances surely you will be getting an output. So for example, if 10 people are getting this treatment done, 8 people will get the output. That's the probability of it. So 80% of the chances surely you will be getting this MPT treatment in that, and this is one of the latest technique. Basically what we do in this technique, in this treatment, is we'll be take the white patch. Okay, so for example, if you are a person having a white patch around your body, we'll be take a particular place. Okay, we are going to take a particular place. We are not going to do all over your body. We are going to take a small patch test. First we'll be do the patch test. Small patch, we'll be taking it up, okay, on your body. In that place we are going to put a artificial melanin. As we have all seen, we know very well, due to melanocytes failed to deliver the melanins, we started getting this white patches, correct? So here what we basically going to do is, we are going to put a melanins artificially to your skin. So your skin will start to accept it, okay, this artificial melanin. At particular point of time, the immune system, the people who are affected by this autoimmune disorder, our immune system create antibodies and try to fight with our artificial melanins, but our artificial melanins pigments will be very big in size comparing to the normal melanin size, so they could not able to beat up. That's why they left that as it is and they'll be goes off. So your melanin will stays permanently and it's going to gives you the perfect output. This is how this MPT treatment works. This MPT treatment provides you the best output. As I said you earlier, it will matches your exact skin tone. But it requires obviously a special skill to connect your exact skin tone. That's what many of them can't able to do it. In our Machu clinic, we have the one who invented this MPT treatment, and we are matching the exact skin tone, and we are expertised from past 17 years, and this technique has been invented 12 years back from us. We are the one who invented this and we have spread it all over the world. Okay, so this MPT treatment really helpful for the people who has suffered by this vitiligo, and it provides you the best output for them. By this MPT treatment, we can bring the exact skin tone. That is the beauty about it. You will not going to get any of the scars or scaloid scars, marks or stretch, nothing will be there. You are going to get the clean, smooth skin. Okay, so our doctors and me, we are all experienced and we can be able to match the exact skin tone as it is. Okay, if you are having in your body, we are doing it a treatment in a different places. One place, if you are having a darker patch, we'll be go ahead with a little darker tone. Another place, if you have a light patch, we'll be go ahead with the light tone. So depends on that, we keeps changes it. That's the beauty about this treatment of MPT. So this treatment, you can ask me the maintenance. Other all the things which we have seen, we need to do the lot of maintenance, tablets, and we need to wait a quite longer time. This patch test, as I said to you earlier, by the patch test we can get to know your skin able to accept the artificial melanin or not. If your skin able to accept this artificial melanin, then we are happily go ahead and proceed with the remaining places of your body. This requires just a month time. Within a month of time duration, we can get to know your skin is accepting the artificial melanin or not. Once your skin accepted this artificial melanin, we can go ahead and proceed with your remaining places. By the next month of the time, you will be getting a perfect output. So when talk about the maintenance, you no need to do anything at all. Just a month of duration, you need to keep apply the ointment which will be providing it to heal that place. Okay, because we are pouring it, right, it's heal the place. Apart from that, you can do all your regular work. Once that 1 month duration has been done, you no need to follow any of the maintenance, but we recommend you to be go ahead, take any multivitamins and supplements so that you will not be get the spreading again. Because if the spreading starts to happen again, then there is a lot of chances you will be get the new patches, because old patches will be there as it is, but you will be chances of you will be getting a new patches will be there. Again, it will not look good. So you need to control it. To control it, we will be recommend you to be take any multivitamins or any other supplements which recommended by your doctors. Okay, so these are all the things you need to follow in our MTP treatment. MTP treatment, 80% success rate will be there, as well as it is very least maintenance. There is no surgery, there is no scars, there is no artificial, nothing will be there. The MTB artificial melanin which I am talking about, it's completely safe. There is no infection, there is no spreading. Many of them things because of this treatment, will that vitiligo will start to spread? No, there will be no spreading will happen. It's completely purely safe to go ahead and getting it done. Even if you are a diabetic patient or any other background medical history you have, this treatment is completely safe for you to go ahead and get it done. No problems at all. So I'll be give you our contact number on the screen. You can go through. If you wanted to book an appointment or anything, you can go through. My team will be really helpful for you. And I have attached my team contact number in the descriptions also. You can contact them. They'll be give you lot of details. Any doubts, they'll clear you out. Or if you guys have any more doubts, please do comment me. I personally see and I will be reply for you guys, and I will give you the best answer to you all. And after the patch test once got success, you can go ahead and proceed with the remaining places. As I said you earlier, this is one of the least maintenance thing. So these are all the 4 treatments available. First 3 are quite common one, and this is the one, the latest, which we are doing it and which we have invented this and we are best in it. Now we have talked about the treatment, symptoms, causes, everything, all good. Now how can I prevent vitiligo? Correct? So there is no particular enough of proof by the scientist that this is the reason vitiligo happens and this is what we need to do to prevent it. There is no particular reasons for that. But being active and show yourself into the direction quite often is good for your skin health, as well as it will be gives you the lot of vitamin D and the C for your body. That's one of the things you can keep it in your mind and keep yourself active and have all the veggies and fruits, meats, all the proteins, everything. So when you have the balanced diet, you will have a healthy skin, I hope so. And this is what the many of the theories suggestion also. So I hope this video is really helpful for you, and please do like and share it to the people who wanted it. And I'll meet you guys in the next session, in the next video. Signing off, Suresh Machu. Don't die mute.